Welcome, it's Raj from 3CB. Over the weekend, Wolverhampton forward and Mexican striker Raul Jimenez suffered a nasty clash of heads with Arsenal center back David Luiz, with Luiz striking his head downwards into the side of Raul's skull. The player lost consciousness, which can indicate a higher severity of head injury, and was stretchered off under spinal precautions and taken to a trauma center. Jimenez was diagnosed with a skull fracture. The skull is comprised of different plates that blend together to form the outer shell of the skull. Now, skull fractures are outside of my expertise, so I reached out to a trusted neurosurgeon for the majority of information in this video. Based on where Raul was hit on the side of his head, it's possible that he suffered a fracture to one of those plates or multiple of those plates. There's 4 distinct types of skull fractures. The most common is a linear or straight line fracture where the skull doesn't move or it's not displaced. And second most common is a depressed skull fracture in which the bone caves in. Further, there's potential for what's called an intracranial hematoma, or ICH, which is essentially a blood clot. The most common that's involved along with skull fractures is called an epidural hematoma, which occurs between the skull and the dura, which is a tough covering of the outer layer of the brain, most typically from a tear in an artery called the medial meningeal artery. Thirdly, there's risk for a contusion to the brain or bruise to the brain in the region where Jimenez was struck. And fourthly, there's always concern for axonal injury, which is damage to the brain's axons, which are the underlying cause for concussions. We know Jimenez had surgery relatively quickly after arriving to the trauma center, but we don't know the details and likely never will. The surgery could have been to address and stabilize the fracture. For example, with depressed fractures, the surgeon will stabilize the skull and then also remove any skull fragments that may have penetrated the superficial layers of the brain. Or the surgery could have been to address the underlying intracranial hematoma and relieve pressure, or a combination thereof. Jimenez's return timeline and career impact is extremely hard to tell because there's so much variance when it comes to brain injuries, and there's so much gray area and variables that we don't know, especially since neuroanatomy and neurochemistry is so sensitive and comprised of so many factors that are specific to that individual. Generally, 3 criteria will dictate Raul's return timeline. The first is the extent and severity of the injury, specifically how much brain tissue, if any, was damaged. Secondly is how he progresses in recovery, specifically looking at any persistent symptoms and his response to activity. Thirdly is the risk-reward calculation of returning. Is there potential for a long-term or serious injury if he does come back? Especially pertinent for positional players, and Raul's case, a player who does present a significant aerial threat. To get an appreciation and sense of that spectrum of injury and return timelines, I have 3 specific footballer examples. The first is Everton defender Michael Keane, who suffered a linear fracture and was back in 1 month. Secondly is Chelsea legend goalkeeper Peter Cech, who suffered a depressed fracture and had immediate surgery to reshape that skull and also remove fragments from his brain. And he was back in about 3 months and wore a protective helmet famously for the rest of his career. Thirdly, and most severely, is Hull and former Tottenham midfielder Ryan Mason, who suffered a severe skull fracture and almost immediately showed potential signs of brain damage and actually had to have surgery just 61 minutes after his injury in order to preserve as much brain tissue and function as possible. During his recovery, he suffered from constant facial nerve tingling and also loss of motor movement function and also massive headaches. About 4.5 months following his injury, he felt good enough where he was attempting to come back to play, but follow-up imaging showed that if he did return, there was serious potential for him to suffer neurological deficits such as epilepsy and dementia just from hitting the ball. Jimenez is optimistic for his return, and that positive spirit and attitude and familial and fan support is critical for recovery. But the most important thing is that he's now stable and surgery was deemed a success. He will continue to be monitored for physical and neurological signs. As the team and player provides more updates and we have more information on his recovery process, I will provide more updates as well. In the meantime, we're all rooting for Jimenez in his recovery, and the key thing is just to take this day by day and step by step.